Bismillahirrahmanirrahim. Assalamu alaikum. A 42-year-old woman come to the office for evaluation of a mass at her right wrist. The patient first noticed swelling in her wrist a few months ago after spending a week knitting blankets for her family. The mass has not caused any pain or stopped her from participating in daily activities, but it continued to slowly increase in size. Medical conditions include hyperlipidemia and rheumatoid arthritis. Medication include methotrexate, statin, and occasional ibuprofen. Vital signs are normal BMI 28 kg. There is slight ulnar deviation at both wrists, with a 2 centimeter mass on the extensor surface of the right wrist and no overlying skin discoloration. The mass is firm, mobile, and non-tender to palpation, and its trans illuminates on pin light examination. Which of the following is the most likely diagnosis in this patient? So this is a 42-year-old woman. She came to the office for evaluation of a mass at her right wrist. The mass has not caused any pain or stopped her from participating in daily activities. The mass slowly increases in size, and the patient has previous history of hyperlipidemia and rheumatoid arthritis. On examination, there is a slight ulnar deviation at both wrists, with a 2 centimeter mass on the extensor surface of right wrist and no overlying skin discoloration. The mass is firm, mobile, and non-tender to palpation, and its trans illuminates on pin light examination. Based on these hints, the diagnosis of this question is ganglion cyst, and here the correct option is choice B, ganglion cyst. So this patient with a mobile non-tender swelling at the dorsal surface of the wrist has a ganglion cyst, which are generally harmless lesions that are most common in patients with underlying joint disorder or prior joint injury. Diagnosis is usually obvious on inspection and can be confirmed on transillumination of the mass. Most ganglion cysts resolve spontaneously and require no treatment. So this is the picture of the ganglion cyst. This is the ganglion cyst which occur on the extensor surface, and here is the ulnar deviation of this patient, meaning this patient having rheumatoid arthritis and joint disease. So ganglion cysts are suspected to that patient especially. Come to the incorrect one, epidermoid cysts. So epidermoid cysts are small, usually less than 1 centimeter, freely mobile nodules, typically with a central puncture, that develop most commonly on the palmar surface of the digits. Choice C, lipoma. So lipomas are soft, fleshy masses found in subcutaneous tissue. They are usually on the trunk or shoulder. Choice D, rheumatoid nodules. So rheumatoid nodules are firm, fibrotic masses typically found in subcutaneous tissue overlying pressure points. These lesions do not transilluminate. Choice E, tendinous xanthomas. So tendinous xanthomas are smooth, firm growths that are most commonly seen in patients with severe hyperlipidemia or lipid storage disorder. They move with the tendon and they do not transilluminate.